everybody in Massachusetts should be enormously proud of what they've accomplished over the course of the past several months in terms of turning the tide, bending the trend in the opposite direction with respect to cases, and reducing it down to a point where, since we started reopening, we've gone from about a 9 or 10% positive test rate at the point we reopened to the point now where it's below 2%. But the last thing we can do is start to think that means there isn't COVID in Massachusetts around and among us. I mean, we've stood here many times and talked about the significant portion of the population that is asymptomatic, both those who never show symptoms and those who don't show symptoms for the first 4 or 5 days that they're actually infected. The whole issue about wearing a mask, socially distancing, washing your hands, the hygiene, all those issues are all about the things that we can do as individuals to help manage the spread. And when the numbers came down and the weather got warm, I think we all got a little concerned that it would be more difficult for people to continue to demonstrate the vigilance that they've shown day over day, week over week, and month over month since April. And I can't express how important it is for everybody to continue to do the things, play by the rules, and use the guidance and the compliance that have been developed by the Reopening Advisory Board to ensure that we continue to fight the spread. We've never said we're going to get to zero without a vaccine. We won't. But the question about how much COVID we have and the job that we do managing the spread does come down in many respects to the individual decisions that get made by all of us. I would argue that we've given more guidance and more direction to schools in Massachusetts than any other state I'm aware of, okay? Secondly, I think it was important from our point of view, given some of the uncertainties that are out there, that we encourage schools and school districts to work on 3 plans. The first one being a reopening. And I think, the pediatrician community, many of the public health experts, a lot of the folks in the infectious disease space believe that it's in kids' best interest for schools to reopen. But that said, it's also going to be important for schools and school districts, if they need to be able to pivot based on the actual facts on the ground in each community, which means you do need to understand how you would do this if you were going to operate on a so-called hybrid basis, some in and some remote, either on a district basis or on a school-specific basis, and on a remote basis. Because it may be that over the course of the next 4 or 5 months, you could have school districts that at one point or another are going to need to know how to pivot from one option to the other. And I think the guidance that we've given them with respect to how to build that, along with the $900 million that we've made available in state and federal funds to support the things that they need to purchase and acquire to implement this, sets them up pretty well to develop those plans. And I know the commissioner and his team have been in regular conversations with the superintendents, the teachers' unions, and a variety of other interested parties, almost literally on a daily basis for the past few weeks. And I think those responses to the guidance that was offered by DESE are due in about 10 days. But I don't know why you would literally say to people, it's all this way or all that way, because circumstances over the course of a school year or over the course of the fall may require people to be able to do more than one. We talked a lot about testing. We talked a lot about the current debate in Washington with respect to sort of the 4th coronavirus relief package. And I think I made a pitch that's pretty similar to the one a number of governors have made about how important it is for the feds to continue to make the sorts of investments, especially in municipalities and state government, and some of the issues around testing that are going to be critical to our ability to do many of the things they would like to see happen. Continue to expand our economies, continue to broaden the testing and surveillance capacity we have, and to be able to come up with strategies and plans with respect to reopening schools. Those are all things that I hear Democrats and Republicans in Washington say they want to do. For us to get from here to there, it's going to be important for them to help us do that.
Did Penn Pence make any commitments along those lines?
He's one player among many. So, I mean, I had about an hour with some of his staff and about a half hour with him. They gave us a lot of time and plenty of opportunity to make the pitch. And I said for a while that I'm optimistic that that both the House and the Senate will find a way to get to yes on this. I mean, I've had a lot of conversations with Congressman Neal about this too, as well as several members of the U.S. Senate. But I think, like many people, I would like to see it happen a little quicker because the clock's ticking, and I'm especially concerned about the folks who are part of the UI system for whom they are very much up in the air with respect to what their benefits are going to be going forward until those folks act.